another episode of Voices of Inclusive Research Podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. And today we will hear the voice of Dr. Krystal Lira. Dr. Lira is a senior research associate at UCSD, and she is doing mental health research, specifically in diverse communities, to assess behavior health needs. And so I am super excited about this conversation because Dr. Lira definitely has heard what the community needs are from the community. So let's jump into this conversation now. How are you doing, Dr. Lira?
I'm good. Yeah. Thank you for having me.
Of course. Thank you for being here. So the first thing we like to ask and want you to share is who you are, why you do the work you do, and how you got into the work that you do.
Yeah. So, as you said, my name is Dr. Krystal Lira. I'm originally from Los Angeles. I live in San Diego now. I've been here for a few years since sort of starting my official career. But prior to this, I got a lot of education. So, I was in school for 10 years. And it's a long time, sort of, but it's the sort of traditional approach, right? If you go and you get a PhD, you're in school for a really long time. And so I started off earning my education in Southern California, specifically in the greater LA area. I went to community college. I was there for several years, and that's when I first learned about research.
Okay.
I actually didn't really know what I wanted to do back then, but I took a psychology course, and my mentor now, who actually still happens to be my mentor so many years later, got me involved in research. So she was like, I teach research methods. Do you want to first I took the course and she's like, do you want to get more involved and like be my assistant and all the things? And so that's how I started learning about what like a career path in research could look like. I was there, I finished up there, I transferred over to Cal State Long Beach.
Okay.
But I actually had transferred over into Cal State Long Beach with a fellowship to go directly into a research program.
Whoa.
So that was really nice because essentially I had already got research experience. And so they were like, okay, you're well equipped to basically go into this structured program where essentially the goal is to help you get to grad school. And so I was in that program the whole time I was at Cal State Long Beach. It was 3 years of being in that program. But essentially, long story short, that program really helped set me up to get into graduate school with still that focus in psychology.
Whoa.
So I've always been really interested in psychology since, again, I've told you, since I took that original course back in like 2011 or something. I was like freshly out of high school. Psychology was always really interesting to me because I always was really fascinated in the way that in trying to understand how people think, why we think the way that we do, what are our thoughts, how they motivate our actions, and the greater beyond. And so my focus has always really been on the idea of motivation. And so during those years of college, I was really interested in understanding what motivated students to be in college, what motivated students to stay in college, with a strong emphasis on diverse students.
Yes.
Because as we know, diverse students, not only are they less represented in college campuses, they're more often to leave college campuses at a higher rate, and they're less supported overall on college campuses for a number of different reasons, right? They just don't have the same privileges, that people perceive them as not having the same abilities, right, as their counterparts, all the different things. I can talk about this forever, right? And that was my main focus in undergrad. I was really interested in that topic. And so I studied that all throughout undergrad. And then eventually I got into graduate school around 2017. And so I went to graduate school. I got my PhD from Michigan State University. So I relocated altogether.
And went all the way to Michigan.
Yeah, I went to
From
Michigan,
Southern California. Yeah, that was the difference.
So that alone, we could have a whole topic or a whole conversation on that move altogether, because that was one of the biggest shocks of my life, I think, because of a number of different reasons.
Yeah,
cultural shock, the academic shock too, going from what is known as a HSI, Hispanic Serving Institution, to a predominantly white institution, aka a PWI.
Yeah.
The difference was really intense, and I didn't really always know how to navigate that. And so anyway, that was something that I struggled with in graduate school, but I went to graduate school and I continued to try to study that topic that I mentioned.
Okay.
So I was still studying motivation, specifically across college students, with an emphasis on students that are diverse in STEM contexts. Mm-hmm. So I was really interested in those specifically that are getting STEM degrees, because you know how I talked about all of these different, I guess, challenges, barriers is the better word, right? Among those, specifically in STEM careers, we see less diverse students. Again, same issues. We see them dropping out more often. We see them having less resources and support. And again, being perceived as having less abilities and all the different things leading to the differential treatment of students in STEM context. And so to me, that topic was super important because we know that if we get diverse individuals to pursue STEM careers, the STEM pathways and trajectories and what we can learn from STEM is going to be so different than what we know today.
Yep.
There's still so much to do in that area.
So much.
It's a really important research area.
Uphill battle.
Uphill battle every day. But that's essentially what I studied in graduate school. My dissertation was similarly, I studied the perceptions and experiences of Black women in engineering. Yeah. So that was really interesting.
Very interesting.
Yeah. And so that's a very specific population
Yeah.
that goes into engineering and again faces those challenges and more.
And did you find these participants in Michigan?
I found them at Michigan State University doing engineering at Michigan State University, and it was 100% Black women. So that was really fascinating just to learn about the challenges that they were facing. You know, I mean, you can imagine their classes are filled with men in general, right? I mean, some diverse men in those areas, but predominantly white men. Yeah. Their instructors are white men. They're all men. And so they were getting a lot of the intersectional kind of battles and challenges when it came to existing in engineering, right? From being a female, from being Black, many of them being low income and being from either a single parent or coming from homes that kind of non-traditional homes, right? That maybe like they were in foster care or they just did not have the same resources as many of their counterparts and peers. And so they shared all of those different things with me. I've yet to publish this work. I actually need to publish this work. I know.
I haven't published my dissertation either.
I know. I need to.
But we definitely
so
need
important.
To do that. It's so important. Yeah.
You know, it's such important work and really tells a story that needs to be heard over and over again, right?
Exactly.
And so that's what I did in graduate school, and I loved it, and I still love it. And as I was coming out of graduate school, I was having a dilemma because some of my gripes with research about, do I really want to do research? What about research do I want to do? Because of some of the challenges that I faced with research in graduate school, and then even still continue to face in some ways. But I think that I came out of it being like, what do I want to do? Do I want to really go be a professor, which was my initial motivation? I wanted to be a professor. Yeah. I was like gung-ho. You could have asked me, I would have been like, what are you going to do when you graduate college? I would have been like, I'm going to be a professor. And there was no other answer for me. But as soon as I came out of graduate school, I was like, I don't think I want to be a professor. So that had really changed for me. And it was like another shock, another moment of shock and kind of like navigating my own personal thoughts and trajectories and where I want to go next. So came out of graduate school doing a postdoc just to continue down the road and kind of see, not jump right into the academic trajectory as a professor. That worked out a little bit, but I wasn't super interested in necessarily in the research. It was still really aligned with the work I was doing as a graduate student, but I wanted to do something different. And that's where I ended up, where I am now.
Awesome.
So
ended up back in San Diego.
So that was cool. But currently doing what I'm doing now, which is more of the community engaged research in some ways, community engagement in terms of being in kind of on the ground, engaging with communities, learning about the challenges that they're facing, and truly being kind of like that first person, right? That is coming to them and saying, okay, hey, let's learn about your concerns in this systematic way. Not to say that they haven't shared their concerns in other outlets or in other ways, but in the work that we're doing currently, I'm very lucky and very privileged to be able to be on the ground speaking with these communities, right? Because a lot of these communities, they're extremely vulnerable. We can talk about this truly forever, but I think that one of the most amazing things about the work that I get to do at UCSD is that we really do get to be in space with communities, and there's nothing like that.
It's nothing like that. That's really the only way to learn what's really going on. It's not a hearsay thing. You got to be there yourself to really see and hear what's going on. Yeah.
Exactly. Yeah. So I got this job where I've been now, it'll be 2 years this summer. I applied to this job because I saw there was opportunities for engaging with small nonprofit organizations, doing evaluation, specifically on mental health and substance use. But mind you, that wasn't my focus in graduate school. I didn't have a background in mental health and substance use. That's not what I went to school for. And yeah, I studied psychology, but it was not with like an emphasis on abnormal psychology or other aspects of like the behavioral health world. And so that already was a little bit scary going into the experience because I was like, well, I went into it with a little bit of that imposter syndrome. Am I going to know enough to be able to be successful in this role?
Okay.
I quickly learned that, yes, I actually probably know more than enough to be successful in this role.
I feel like that's like a good transition.
Yeah.
Yeah.
It didn't seem like it to me at first, but again, it only took a few months for me to realize that I was like, oh, actually, I could totally do this. And in fact, there's a lot And I was happy to be in the role because there was a lot of the aspects around being forward facing the community, engaging with communities, knowing how to speak and be in present, like in the presence of certain community members, right?
That's a good topic. I love that. We're going to be talking about that on our networking event that we have coming up February 18th. We're going to do a fireside chat. The fireside chat is going to be about guidelines or best practices on how to address the community and how to engage with them. This is a huge topic in pharma right now because we are trying to reach the community and they need to understand how to do that. So,
and it takes skill. I mean, it takes a level of skill. I mean, I think in many ways it takes the lived experience. I think that's a huge piece.
Yes, the lived experience is.
It's like a lot of the communities I'm being asked to go speak with or be around or share space with are communities that I either completely relate to because it's my community or it's a shared community or a community that has similar experiences, right? And so I can relate on some level. Of course, they have their unique challenges, unique experiences, right? But I think the lived experience piece is extremely important. And that's why we're seeing that effort all across the county right now. The counties finally recognize that you need what they call lived experience advisors. Are you familiar with the lived experience advisor model in the county? So the work that I'm doing at UC San Diego currently is contracted through the county.
Okay.
So San Diego Behavioral Health Services specifically contracted our work several years ago now. We're probably going into our third or fourth year. I'm drawing a blank, but essentially they funded a 5-year contract.
Okay.
Which is typical in San Diego County specifically. And so they funded this 5-year work of the evaluation of mental health and substance use needs and concerns in the county. But as a result of being in this space, I've learned a lot about what the county priorities are.
Okay.
What the county is currently addressing, the different initiatives that they're working to address, because the county has different branches and they're all doing different things and trying to meet the overall need. But there's always a focus. Anywhere you go, there's a focus, right? And so the county has a specific focus on what aspect of mental health they're working on, what aspect of behavioral health they're working on, and substance use. And so one of the things, to go back to the lived experience piece, they've recognized over the past several years the impact and importance of having lived experience advisors in different contexts.
I love that. Lived experience
advisors. Yeah. And so they're lived experience advisors. They call them peer support specialists. There's different names for the role, but essentially, in essence, what it is, it's an individual who has lived experience, either in mental health, substance use, or both. They had a occurring disorder. A lot of them, as you know, once you've entered that behavioral health realm, you've experienced sometimes challenges like homelessness. You've experienced challenges just like general financial insecurity, right? All the things, right? It's all so related. And so these individuals, I've had the opportunity to talk with them through the work that I'm doing at UC San Diego, which I'll share more about, but they have really had the opportunity to be on the ground, sharing their lived experience to be able to support those that are currently in need.
Man, I love that.
That have been since rehabilitated maybe, or they're benefiting from services in a really positive way, or they're receptive, or all the different ways. In many ways, a lot of them use that terminology like I'm rehabilitated. Either they're using that as an employment opportunity or they have an employment opportunity somewhere else. They're no longer unhoused on the streets, but they have that lived experience. So they can relate.
That's empowering.
Yeah, it's amazing.
For sure.
Yeah.
I love that idea because it's very similar to what we're trying to do at Diverse Research Now with our study buddy program. I guess our buddies don't have to per se have a lived experience. They're just kind of there as support. But the piece that I'm trying to get to is the empowerment piece. I think that's super empowering for someone to have someone they can talk to that understands what they're going through, that can help with resources, that can kind of walk this journey with them. I think that's super important and a piece that research doesn't really have. I think that will be super helpful to bring that in as we are trying to bring awareness to how research is valuable to the community. And we need other people in the community that is going to have those lived experiences, which is why we started this podcast, to share the lived experiences of people in the community. Hopefully we'll get more and more people in the community to come on and kind of share their experience with research, good or bad. Honestly, I don't know if these lived experience advisors always have the best experiences, but I mean, it's good to be transparent in these situation. So how is the program being used with your job, with your position, or your research?
So let me give a little background to the position, just so it's like very clear essentially what I do on a day-to-day basis. So I was hired on as a senior research associate as well as a community outreach coordinator. So my role really is to be in the community, learning about different kind of nonprofit organizations. That's how I learned about you, right? I was actually thinking about how I met you, and it was
we met at a health fair.
Yeah, we were both tabling.
Yes, we were both tabling out in the community.
Yeah, we were out tabling in the community. I was walking around because I always do my rounds. You know, I'm at the table, talking to the community, but I talk to the orgs around, right? And so I do my rounds, and I went up to you, and I was doing one of my rounds. I was like, let me see what they're all about. But what's interesting is I actually gravitated through like a personal interest because I was like, oh, I'm
exactly.
I think I was like,
going back to the research.
Piece. I was like, this is so important, right? Like the visibility, learning how to build trust in communities around research, understanding why communities have mistrust, how to even heal from that. So anyway, from a personal level, I was like, the org is cool. The org is awesome. I want to learn more.
Thank you.
But it was so aligned with the work that we're doing at UCSD because in many ways, the work that we're doing at UCSD is also, again, on the ground. We're learning from community orgs. We're learning from community members around their concerns around mental health and substance use. And so the 5-year contract really was to bring us on so that we can serve as those evaluators.
Good. Which is one of our focus areas is mental health research. So that's why we were really excited to partner with you guys.
Right. Yeah. And so that was really wonderful, the things we've been able to do so far together. But I think that in many ways, the work that we're doing has really allowed us to be in those spaces with your organization and other similar organizations that are doing work in community spaces to learn about those concerns. Now, one of the reasons why the county wanted to bring on this type of contract is because historically, and you probably relate to this very much in terms of the org, is that they feel as if communities have been silenced or they've not had a voice in the decision making that happens in large governmental organizations or large processes.
I love this.
Right. Yes. So they were like, okay, let's bring in these individuals who can help connect us in some ways to the community to learn about, bridge the gap, to learn about those concerns. And so in many ways, we've been able to do that through these structured listening sessions that you're aware of, the context of those. We do kind of small one-on-one interviews and we do focus groups and we just attend community forums and events. And, I've been to your events and I go to other community events and we just engage with communities in ways that we try to map onto that authenticity piece, the piece around wanting to really understand and learn about a community space or community org.
Yeah, and really listening. So you're going to these events, listening. We did an event together. Our monthly event is called Chow and Chats, where we chat with the community about some health condition and then we feed them. Yours is listening sessions, and I don't know if you guys have food, but
we always do the listening sessions.
Because you gotta have food.
You have to. I mean, at the very least, right?
You gotta feed the people, So it's very similar, which is why we came together and had that event together, where we kind of did a listening session / chow and chat, and we talked about mental health in the community. We came together to do that, and at the session, you guys were not just speaking to the community, but you were documenting what they said.
Yeah, exactly.
So that is so important too. So you can document that and take that back to the people who are making the decision.
Exactly.
That is so important.
Exactly. And so that's the piece, right, that you summarized it so well. That was what I wanted to say. The last piece to this really is that we collect all the information, we summarize it, you're right, we document it, and we honor the information too, right? One thing we don't do, and it's super wonderful to work with the team that I work with because they honor the words and they share the words as they're stated, right? We're not over here trying to make a story up to make it sound interesting. There's a lot of unethical research that happens where people want to tell a story or they want to shape it a certain way to kind of meet whatever narrative. We want to share the information as it's stated. And so we give that information to the county as it's provided to us. And so we try to do it as raw as possible. We say, this is what we heard. This is what we learned. I think one of the tensions of this work has become the feedback that we're receiving from the community about this. And that is, now what is done? What are you going to do with it? What's going to happen?
Come on. They want to see action.
They want to see action.
They want to see things change. That is the next step. So as we're collecting this, yes, you were doing good work, getting the information, getting the community voice heard. What's the next step?
So we're currently working with communities and learning from communities rather having those conversations, that dialogue, to try to explain to them the process in which this happens. And we feel that tension too. And this has always been my tension with research. And I think it's a lot of people's tension with research. We want action, we want results now. Show me what's going to happen with this. It's not always realistic.
Yeah, especially in research. In this field, things don't happen quick.
They don't happen quick. I think we were talking about this offline, but right, this idea of you're hearing the same things over and over again, and the concerns are the same, and they haven't changed. And if they've changed, they changed incrementally. And people see that and they feel that in the community. So they're coming to us and saying, well, we've heard this all before. We've said this all before. It's been years of saying this. Nothing has changed. It's a tension, and it's hard for us because we don't have any control. It's hard to feel that powerless in that moment of like, I can't do anything about that specific scenario. That's just my personal kind of issue with this so far.
Yeah, because you're like the middle person. You're the one bridging that gap. And that's a challenge that we face too. Diverse Research Now being the bridge between researchers and the community. That's why we're trying to be the bridge, but also work on the other side of that bridge with the researchers and make sure things are changed, make sure action is being done.
That's amazing.
And so we are in the community, but we also are talking to the people making the decisions too.
That's amazing.
So, and I know that you're taking that information back. I guess the question is, when you're taking that back to the people who are making the decisions, do you have any idea of what they're doing with it? And how are you brought into that anyway? I guess you just said that that's kind of your issue.
That is the issue. That you're not really involved in that. So in that case, it sort of feels disconnected. There's a disconnect between the bridge is not fully connected, because if they want us to bring back the information, the best actually, I'm so glad you explained it the way that you did for Diverse Research Now and what you do, because at the end of the day, the results will be better if you bring in those who know it best. And so we are out in the community. I want to talk about some of the concerns in a moment here that we've been hearing from the community. But if we know them best in terms of what's being shared, the raw information of being shared, why should we not be brought into the conversation about what needs to happen next?
Yeah.
So because what happens is there's a disconnect.
No,
like they get the information and they may process it one way, but it's actually another way. That's become a really huge tension of just trying to see where the needle is moving, if the needle is moving forward, if it's not moving forward. I mean, and truthfully, we don't know. For all I know, they're making a ton of changes behind the snes, and we just don't know it yet because they haven't shared that information. So I will
you haven't seen it.
We haven't seen it yet
because it takes time to see the change.
Yeah, but just the main tension is that since we are forward facing the community, they're talking to us and they're telling us, so what do you know?
All the hits.
Yeah, it's like we're also, I'm not going to say a punching bag because truthfully, they're kind and generous and understanding. But at the end of the day, some people are frustrated.
Of course.
And they're tired. And their community is struggling. They're struggling. They're
so many things.
Many things.
This is just another thing. But there's so many things that the community is dealing with. So before we get out of here, tell me, what do you want to pharma and these biotech companies, these sponsors, the people that's doing the research, the people that's coming up with these initiatives, what do you want them to know that you've heard in the community?
I think that's a great question. So I think one of the primary takeaways from this is that individuals in the community are feeling like there's just not enough resources to meet the demand. We're talking specifically in reference to mental health and substance use. I can't speak to the other aspects of the need in the community, but specifically they feel like if they need to access a mental health resource, if they need to access even a substance health resource, let's talk about maybe potentially detox as one example. There is not enough detox centers in this county of San Diego, even in the city of San Diego, to meet the demand that is out there. There's long wait lists, there's long wait times, there's long requests in terms of transportation. There's a disconnect between individuals who speak one language and the service that they're getting provided in a different language. So there's the cultural barriers that they're facing too, and the services that are being provided. And so when I think about the biggest takeaway from everything is that individuals feel like this county is very impacted in terms of how many individuals we have, and there's just not enough resources. And some of those resources, if not many of those resources, are not adequately meeting the demand that's there through a number of different mechanisms, including, again, the long wait times, the cultural disconnect, the costs, right? We know that cost is a huge barrier, including insurance and all of those different pieces. And so it's kind of multi-layered, but it really boils down to the fact that people do not feel supported in the community.
Okay. And so it makes me want to ask the question is, do you think that research, because there's one thing that we try to share in the community is the research opportunities.
Yeah.
There is mental health research studies going on.
Yeah.
And a lot of times the community doesn't know about it.
Mm-hmm.
Which is why we're here to bring that awareness. Do you feel like the research opportunities could be a resource? Could be a part of the resources that we share with the community?
I mean, I think there's some potential for that. I don't know that just the research opportunity itself would necessarily be the most ideal resource based on what we're hearing.
Okay.
Though, if the research opportunity connected them to resources.
Well, that's what I mean. Because I think the research opportunities, this is what I was trying to bring home, is I think that research and the resources have to go together.
Correct.
So that's why at our challenge chats, we always usually try to have resources there too for the community. Because yeah, everybody's not going to go into a study. They're not going to be eligible. But we don't want to just leave them by alone or leave them without anything. I think that's a good point to end on, is connecting research with community resources and even have them working together. Yes, the research could be a resource. They could go into a study that's going to help them with medication, get the medication they need. That's going to help with the cost factor. I think it's just time to think outside the box and really see that, hey, yeah, that actually could be an option for someone that's going through a mental health crisis to get into a study where they can get free medication. Why not? You know, that could be an option. But again, everyone is not going to go that route. So you still have other resources that they can tap into.
Yeah.
If they don't go into research. I think we have to come together, which is, I think, is one of the challenges in the field right now. Is just, I think pharma and biotechs and the sponsors are trying to understand how to work with the community organizations. And I think that's how you do it. You have to come together and be at the events together.
You do.
Be out in the community with the community resources and become a resource for the community. I like that. Become a resource. The research should become a resource for the community.
Yeah, because otherwise, I think people are inundated in the community, right, with a ton of asks, requests, including even ours in some ways, that they don't feel like is bringing them what they need, what they want in that moment, which is a resource, which is help, which is push me in the right direction. I'm helpless. And so if research could be bridged to bring those resources to the community, that's one way to really engage communities in a different way.
It's a route. It's so many different ways that we can touch the community and help them. But it all comes back to helping the community.
Correct.
I mean, honestly, that's why I'm in this field. And that's why I bring awareness to research, because I do think that it's not thought about in the community as a source,
as a resource,
or option in their healthcare journey. It's not thought about, but I think that it should be, because again, there's several different research studies going on. It could be a research study happening for your condition. You could get into that study and it could really help you. I have stories, and I'm hoping that we have more and more stories like this, but there's been so many stories of people saying that, oh, that research study saved my life.
Yeah.
That research study did. You know what I mean? And that's why I'm highlighting it in the community and really bringing awareness to it, because if it could save one life, that would make me happy.
Yeah.
So,
yeah. And I'm glad that, it's you and your organization that is that bridge, because I think that in terms of some of the issues that I've historically had with research is the overall exploitation of communities through research, right? And that's not something that your organization does or would ever even do. But certainly a lot of individuals in the community are not trusting of research. They're not, and they do not want to associate with it in any way. But based off of what you shared, there's a lot of benefits, especially when it's done right, when it's done with authenticity, when it's done from people who care and who want to bring the resources, the practice, all of the different forms of community care into that experience.
Exactly.
You know,
it can't just be about collecting the numbers or collecting the data.
It can't.
You have to care for the community because these are human beings. These are people living everyday lives. We have to care for the whole person.
Exactly.
So it's just not about getting data for research and making them a number.
Yeah.
You have to make them feel like you actually care and you're going to help them with other things that's going on in their lives. That's huge for us, and which is why we wanted to create our Diverse Research Now as a nonprofit, somewhere we don't want to take any profit for the community. We want this to be a public good organization where we're serving the community and really helping in that way. So
that's amazing. Yeah, you guys are going to go really far.
Yeah, I'm hoping. We're hoping to. I like that. I have to go back to that tag. Like the research should become a resource in the community. It's very true. So, okay, well, thank you so much for being here today, Dr. Lira. I really appreciate you, and I'm looking forward to all the other work we're going to do together.
Oh, for sure.
We're not done.
Yeah, no, this is just a start.
All right, take care.
Yeah, thank you.